Hello, my name is Vera Becha. I'm a microbiologist PhD candidate at University Hospital of Obstetrics and Gynecology, Queen Geraldine, Tirana, Albania. Today, I will present key findings from our study investigation, the impact of obesity on maternal and perinatal outcomes among pregnant women with COVID-19. Obesity is increasingly recognized as a major global public health issue, particularly in the context of pregnancy. Over recent decades, the prevalence of overweight and obese women have reproductive age has significantly risen, and the COVID-19 pandemic has added new complexities to maternal care. In our study conducted at the University Hospital Queen Geraldine in Tirana, Albania, we retrospectively examined the cases of pregnant women hospitalized with confirmed SARS-CoV-2 infection between January 2020 and December 2021. Our primary goal was to determine the association between pre-pregnancy body mass index or BMI and maternal and neonatal outcomes, and they assessed whether the so-called obesity paradox applied to this patient population. A total of 83 pregnant women were included in the study. Of these, more than two-thirds were either overweight or obese. Obese patients in particular showed significantly worse clinical courses. They had longer hospital stays, extended ICU admissions, and were more frequently affected by multi-organ failure. Furthermore, they were more susceptible to hospital-acquired infections, including drug-resistant ones, and required broader-spectrum antibiotics therapies. The need for corticosteroid treatment was also higher in this group. Most concerning was the increased incidence of adverse outcomes. Obese patients experienced higher rates of stillbirth and lethal maternal outcomes. These patterns highlight the severity of COVID-19 when compounded by obesity during pregnancy. From a cardiovascular standpoint, we observe a clear association between excessive maternal weight and the development of gestational hypertension. Obese women were also more likely to report a positive family history of cardiovascular disease. These findings reaffirm that obesity is a universal risk factor for arterial hypertension, and pregnancy is no exception. We also examined placental pathology. The highest grades of placental maturity were observed among obese patients. Accelerated placental aging may contribute to the poor fetal outcomes noted in this group, including preterm birth and stillbirth. Another important finding was the correlation between obesity, COVID-19, and anemia. Anemia was more frequently documented in obese pregnant women with COVID-19, raising concerns about compounded oxygen delivery deficits in already compromised respiratory system. Most notable pulmonary embolism was diagnosed only in the obese group. This serious and potentially fatal complication was supported by the observation that D-dimer levels were nearly twice as high in obese patients compared to women with normal MBI. This underscores that heightened thrombotic risk in obese pregnant patients infected with SARS-CoV-2. Despite ongoing debate in the literature regarding the direct causative role of SARS-CoV-2 in poor pregnancy outcomes, our findings provide compelling evidence that obesity significantly amplifies the risks. In this vulnerable population, the combination of obesity and COVID-19 results in worse maternal and neonatal prognosis. So, what are the clinical implications? Firstly, it's very important to identify high-risk pregnant women early, especially those who are overweight or obese and have COVID-19. Doctors should closely monitor their vital signs, inflammation level, and blood clotting tests. These women may also need more frequent ultrasounds to check the baby's growth and the health of the placenta. Second, acting quickly can save lives. In our study, all early preterm births happened because the mother's conditions got worse. This shows that making a decision earlier, like planning delivery or giving treatment sooner, could help prevent serious problems like organ failure or even death. Third, teamwork is key. Doctors from different areas, anesthesiologists, obstetricians, ICU doctors, and infection specialists need to work together to care for these patients properly. In conclusion, our study shows that special care is needed for obese pregnant women with COVID-19. These two risk factors together make pregnancy more dangerous. Watching the warning signs early, like high blood pressure, breathing problems, or signs of blood clots, can help prevent bad outcomes. Lastly, we believe public health programs should help women manage their weight before pregnancy and get better access to prenatal care. This is important not just during the pandemic, but for healthy pregnancies in the future. Thank you for your listening.